Hello everyone, welcome back to my channel. So today we have a case to discuss. So this is a case of complicated cataract for which we will be doing phacoemulsification, and the grade of the nuclear sclerosis is around 2 to 3. So let's start the case. So the side ports are made with the help of MVR blades, and then phenocaine is injected, and I can see that there is no effect of phenocaine. I have directly started with the injection of trypan blue dye to stain the anterior capsule, and which is then washed with the help of BSS. I can also see that there are posterior synechia, and there is a adhesion between the anterior capsule and the iris. So my plan is to release the posterior synechia with the help of any blunt instrument. You can use either iris spatula or you can also use the blunt Sinskey hook. So I will be using Sinskey hook to release the synechia from both the sides. And now the next plan I have made is that I will be doing uh, sphincter pupilloplasty, and I am using the blunt Y hooks to stretch the pupil in two directions, and I have performed this multiple times. And if you will see closely, if you will look closely, you will be able to see the small hemorrhages at the margin of the pupil. This is because of the tearing of the sphincter. And now the dilatation is adequate to perform the capsular access, and main port is created with the help of 2.8 millimeter keratome, and I can see some unstained areas of the anterior capsule. So I have planned the removal of viscoelastic substance and again re-stain the anterior capsule to have a uniform staining. And once the visco removal is done, trypan blue is again injected to stain the unstained areas of the anterior capsule, and I'm trying to wash it from the anterior chamber, and I can see that the staining is now uniform, and capsular access can be initiated with a more safety. So I am using 60 tome needle to make a adequate size of capsular access of around 5 millimeter. Now the capsular access is completed, which is of good size, and the routine hydrodissection and hydrodelineation is performed to release the nucleus from the adhesions of with the capsule, and I'm performing this maneuver from the both sides. So the visco is injected once I'm sure about the hydrodissection procedure, and nucleus is then rotated. And here I am just checking the mobility of the nucleus, and this will confirm the adequate hydrodissection. And now let's start with the phacoemulsification part, which is the unedited part. You can enjoy it.
नहीं कोई नहीं लगा
हाँ तो बाहर बैठ जाओ। हाँ क्या रही है बाहर बैठ जाओ।
खांसी है क्या उनको ज़्यादा है क्या
और राम रेपुटेशन
है
यही है वो राम रेपुटेशन
इसका ऐसी वॉश करना है
हाँ
हाँ पूनम जी, खाना खा लिया? अरे गुड मॉर्निंग।
ग्लोव करो फिर रेड।
हाँ आइए वाले। नेक्स्ट पेशेंट।
आ जाओ आ जाओ। इधर बैठ जाओ। इधर सर रख के बैठना, हाथ नीचे, ऊपर खींचो और खींचो। बस ठीक है ठीक है। गर्दन सीधी कर दो, मतलब बस ऐसे हाथ नीचे रखना, ठीक है?
ठीक है बेटा।
नरेश,
आ जाओ।
उनको पोस्ट ऑप में 40 mg स्टेरॉइड भी चलानी है।
इनको ठीक है।
स्टेरॉइड्स है ना, वाइसोलोन या फिर ओमनाकोटिन, जो भी अवेलेबल है।